Hello, and thank you for joining us tonight for our free webinar, Diagnose and Treat the Invisible Infection Causing Chronic Disease in Your Patients, featuring Dr. Jeremy Steiner. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. We intend to provide, or with our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of the guest speaker, please use the Questions tab to assure that we see it at the end of the lecture during Q&A. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. And you may always visit our blog and use the free webinar tag to find all of our previously recorded events. From sports acupuncture to neuroscience to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speaker. I'm proud to introduce Dr. Jeremy Steiner. He is a scientist, acupuncturist, traditional medicine practitioner, teacher, clinical supervisor, and founder of Electro-Acupuncture medicine. He's licensed to practice acupuncture and traditional medicine in New Jersey and Florida. He has successfully and safely given more than 60,000 treatments, of which a significant number were in the treatment of the most severe disorders such as paralysis and non-responsive pain disorders. Please join me in welcoming Dr. Jeremy Steiner.
Thank you, Jeff. Hi, everybody. Can you hear me? Come in the comments section. Let me know if you can hear me. And I'm going to be asking for a lot of participation during this. So, okay, I see Pam says she can hear me. All right, you guys can hear me. Awesome. So I have a great class planned for you. I've got case studies. I've got research. I've got protocols. If you stick around with me, it's going to be about an hour. I'm going to be delivering the goods. So this is how my revolutionary DAO healing system diagnoses and treats the invisible infection causing 90% of the chronic disease in your patients. Now, I'm going to be honest with you guys. I've been keeping secrets. I've been even keeping secrets from Jeff and LASA. There's 2 secrets in the title. Does anybody think they know what the invisible infection is that I'm talking about? If you think you know, if you have an idea, come in the comment section. Let me know if you know what the invisible infection is that I'm talking about. All righty. I see some of you probably have studied with me before. So before we start, I'm curious, what would it feel like if you could predictably identify the underlying cause of the most severe, bizarre, and chronic disease which goes undiagnosed and untreated in your patients? How would it feel to be able to help patients not helped by any other doctor or medical professional? What would it feel like to be viewed as a modern-day master in the entire medical community? Give me a number. What would that be worth to you? What would any of this be worth to you? Give me a number, somebody, so I know that you are with me. I see Stacy says priceless. If the answer is priceless, then you're in the right place. Now, if you ever encounter patients whose disease or ailments seem like a mystery and nothing you try provides permanent results, I totally get it. Now, I just want to tell you briefly about me because it's all going to make sense in a few upcoming slides. But after graduating in 2007, I excitedly ventured into my new career as an acupuncturist. Unfortunately, things didn't go quite as planned. Patients would come to me with ailments, many of which hadn't been helped by other medical approaches. I'd get excited to treat them. I do it all by the book and apply everything I learned in school. The results: some would get moderate relief, some wouldn't, but few would get lasting or permanent results. Now, I know all my patients got results, but the problem wouldn't go away permanently. The truth is, I started to lose faith in our medicine. So that's when I set out on a journey to learn from the best. It was on this journey that I discovered what I now refer to as the invisible infection. You guys are going to have your minds blown in a few slides when I go over this. It's actually the root cause of disease affecting more than 90% of our patients. And get this, no one talks about it. I set out to treat it and develop my DAO healing system that you're going to learn about when you stick with me through this training. Now, I like to feature my successful students. So Dr. Mark says, getting almost an immediate positive response. Why didn't I learn this 20 years ago? Dr. Bill's patient says, my arthritic hip feels better. Does this treat that too? Conchman says, it's such an impactful therapy. I was able to handle many difficult cases with such an ease. Fewer needles are used and results are amazing. And Carrie says, patients are responding better than ever. She learned more in one weekend than I had in my entire 3-year acupuncture program. Now, here is what you're about to learn on this webinar. The invisible infection nobody in the medical community is talking about. That's the root cause of nearly all tough to treat disease in patients everywhere. A powerful diagnosis method to uncover the invisible infection by approaching your patient's symptoms in an entirely new way. Proven protocols designed to attack the invisible infection. Just a handful of these protocols can make a huge difference in the health of over 278 million Americans. And you're going to see proof, and how my DAO healing system will quickly turn you into a master healer and instantly boost your status in the medical community. I know it sounds crazy, but I'm about to show you. Doctors and peers will be sending their toughest patients your way. And I'm going to teach it by sharing excerpts from my curriculum from my upcoming Electric Medicine 3 live event. Now, after teaching 2,000 or more acupuncturists, I started to see a vicious cycle acupuncturists stayed stuck in while trying desperately to heal tough to treat disease. Here's the cycle, and here's what I heard from my students. Frustration sets in when the treatments we learned in school aren't working well enough. We spend hours researching independently, but still can't seem to address the root cause of our toughest patients' diseases. Many practitioners just assume there are certain ailments that acupuncture isn't ideal to help with. They turn to herbs hoping for better results, but often experience more of the same. We'd all love to gain respect in the medical community, but it's pretty darn hard if we can't solve these tough problems. Even worse, patients who don't get permanent, lasting results book less or stop coming altogether. So we're left seeking new patients to keep afloat, and the cycle continues. Come in the comments section. Let me know, have you ever related to any one of these? Come in the comments section, let me know, and let me know that you can still hear me and you're with me before we dive into the goods. All right, Julie says yes. Karen says yes. Don't worry, you're not alone. In fact, it's not your fault. The truth is your toughest patients suffer from an invisible infection that nobody in the entire medical community talks about or even looks for. Do you want to know what it is? Okay, here it is. The invisible infection is called dental cavitations. Now, dental cavitations are dead, infected tissue caused by lingering side effects of routine dental work that nearly every person has had without thinking twice. It's not a question of if you have dental cavitations or not. It's a matter of how bad are they. So by the end of this training, you'll see why dental cavitations are the invisible infection responsible for chronic and seemingly untreatable disease in 90% or more of your patients. Let me explain. So root canals, more than 100 million Americans have had at least one root canal procedure. That's roughly a third of our population, as you know. 41,000 root canal procedures are performed every day in the US. And every single root canal turns into an infection after 30 days. Of course it does. A root canal procedure, they're disconnecting the blood vessels and the nerve flow and the chi flow. They're disconnecting it from the tooth. They're killing the tooth and leaving dead tissue in the body. Over here on the right is a picture of just an average root canal that's pulled. Every single one of them will be infected. And if you notice that I kept the comment at the bottom, the patient had been recommended to have the root canal retreated. Why is that? We're going to see in an upcoming slide. So like I said, it's dead tissue left inside the body. It drains chi from an associated channel This is the coolest thing ever, the dental acupuncture channel connection. It's a breeding ground for pathogens such as bacteria, virus, and fungi. And the pathogens have a direct access to the circulatory system. This is why if somebody has a heart issue, their cardiologist likes to prescribe an antibiotic before that patient gets any dental work done, because that cardiologist knows that there's going to be bacteria and pathogens from the mouth dumped directly into the blood. Now, over here on the right is a research which I took from the Journal of Endodontics. Now, endodontics are root canal specialists. And what they did in this study was there were 2 teeth that were going to be pulled. They were probably wisdom teeth. And instead of pulling them right away, they did an experiment. They did a root canal procedure on one and left the other one. And then 3 or 4 months later, they pulled both teeth and then analyzed them. And this is what they saw. The root canal tooth, after 3 or 4 months, was 39% infected, while the non-root canal tooth was only 1.1% infected. Now, those lingering root canal infections are responsible for side effects directly related to more than 16 different heart and circulatory diseases. On top of that, almost all root canal teeth harbor strep viridans bacteria, which is released directly into the blood, attaches to the platelets, and damages heart valves. If you look over here on the right, here's a photo of a heart valve that's damaged from the pathogen coming from the mouth. It's no coincidence that heart disease is the #1 killer in the world, causing 659,000 deaths in the US in 2019. So another problem is wisdom teeth cavitations. 85% of Americans will end up having wisdom teeth extracted. If you look at this cone beam scan on the right here, you'll see I've circled the areas. They had the wisdom teeth removed and a cavitation remains. Now, wisdom tooth cavitations are extremely common, with around 75% of wisdom tooth extractions failing and becoming silent, invisible infections. Here's a picture of a cavitation. The symptoms are silent. There's no sign in the mouth. The sign comes out, the symptoms come out, and the disease comes out elsewhere in the body, like the acupuncture channels, which I'm going to show you. So you may be wondering, if dental cavitations are so dangerous, why don't dentists fix this problem, right? Well, I've taken this. This is the standard of care rule book from the American Association of Endodontists. So medical doctors, dentists, everybody in the healthcare field, they have their own treatment standards and standard of care laws that they're expected to follow, or they risk losing licensure. So this is taken from the treatment standards of the American Association of Endodontists. And this is just a quote that I pulled. Holistic dentistry that advocates and recommends extraction of endodontically treated teeth, aka root canal teeth, or removal of metallic fillings. Don't even get me started on mercury. I don't have time to include mercury in this presentation, but more than 50% of the dentists are still using mercury in the mouth. That's a story for another webinar. Claiming systemic harm are unacceptable and disrespected minority views. This basically means no dentist is allowed to go against this statement here. Here's another one. Persistent disease following root canal treatment does not necessitate nor obligate tooth extraction. So if a dentist speaks out against official standard of care, they risk losing their license. Not to mention endodontics, which is an entire industry built around root canal procedures, would be put at risk. So I think we can agree it's crystal clear why dental cavitations remain an invisible infection that nobody talks about. And if the medical community, including acupuncturists, aren't looking for something, they obviously can't diagnose and treat it. The bad news is if you don't know how to diagnose and treat dental cavitations, it's nearly impossible to completely reverse disease in many of your patients. Now, I see Amal asked the question. Put your question in the questions section, and I'm going to do a dedicated Q&A at the end of this. So the good news is there's a solution, and that solution is DAO, and DAO stands for Dental Acupuncture and Oriental Medical Healing System. So after spending 12 years developing my DAO healing system to address dental cavitations through the acupuncture channels, I'm going to break it down for you on this training. So shut down distractions, get out the notepad, pay attention, and suspend your disbelief. And give me a second, I'm going to drink some water, but come in the comment section, let me know that you guys are up and you're ready to learn this stuff. Now, why do I say suspend your disbelief? Well, that's because, you know, I may be teaching you something on the upcoming slides that may challenge your belief system. But the way to gain the most out of this webinar is to set your beliefs aside, at least for the next 30 minutes, and just be a sponge and absorb all this awesome information and then take it back to your clinic and implement it. Let me get a sip of water here. All right, I see Carolyn says ready, Stacy says ready, Jessica says ready, Heather says so ready. So, one important note, my entire approach to medicine, Tao healing system included, relies on the P3 acupuncture method. Now, I know some of you have studied with me and taken P3 method, and some of you don't know me and have never taken my P3 method. So I need to go over briefly the P3 method. I did a webinar for Lhasa a while back on the P3 method. But here's the P3 method. The 3 Ps is paradigm, pattern, and protocol. So let's talk about the pattern. The paradigm. The most common paradigm taught in many schools is that chi is a mystical life force energy. Acupuncture channels are where this chi flows, and disease is from a blockage or imbalance in these channels, and acupuncture balances this chi. This is what was taught to me in my school. It's taught all across the nation. It's tested on national boards, and it's probably even true. However, when I was talking with my patients or other healthcare professionals, this paradigm did not serve me because their eyes glossed over when I was talking about that chi is a mystical life force energy. So what if I told you there's a different paradigm that eliminates treatment boundaries? Here is the new medical paradigm. Cells are always wearing out and need to be replaced. Disease occurs when we lose the ability to make new cells. And I put some cellular regeneration times. What does all this mean? Well, every 4 months, our blood cells are completely regenerated. Our blood cells only last about 4 months. And then complete new blood cells come in. Now, if you look at the stomach, 5 days, the inner lining of the stomach regenerates every 5 days. So knowing these cellular regeneration times and knowing that we can help restore our patients back to healthy functioning cellular regeneration times gives us a good prognosis of how long it's going to take for our patients to get better, depending upon what tissue it is that needs to be regenerated and returned to proper functioning. Now, what is needed for cells to regenerate and function properly? Well, number one is electrons, aka chi. Now, as you know, there's many different types of chi. This is the chi that flows in the channels that I'm talking about. We also need raw nutrients, because once we restore the proper chi that the channel maybe wasn't providing, then we also need raw building blocks, the amino acids, to build up all the proteins. How can you build a house without bricks? And what supplies the cells and tissues with electrons? Well, that's the acupuncture channels and conductive outer covering of nerves. So what are the acupuncture channels? Well, the acupuncture channels, which is separate than the nervous system, it's made up of stacks of muscles, and muscle tissue is a very special type of tissue. When you stress it or stretch it, it produces chi. It is like a piezoelectric. If you take a crystal and you squeeze a crystal, chi is going to come out of it. And our muscle tissue is set up like that. So when you move it, when you exercise, qigong, when you stimulate it with needles, the muscle tissue itself can produce this beneficial chi, and it also can store it like a rechargeable battery. The fascia is the most conductive electrical tissue in the body, and it's a cross-webbing link of germanium and silicon, and it conducts electricity in one direction only, and it wraps every single muscle and creates discrete circuits, which were laid out thousands of years ago, as you know, by the ancient Chinese. Now, If you know me, then you already know that I use electricity on everybody. And here's a quick, if you don't know me, I need to give you a quick note about the use of electricity in medicine. So old school practitioners think that they have the misconception that using electricity is barbaric and possibly even dangerous. They erroneously think that you can't use electricity on older patients. The most patients I have are geriatrics, and everybody gets electricity because it's so benevolent. It's such a benevolent healing force that it's great for anybody, whether they're deficient or excess. And I'm going to show you what I mean in some upcoming slides. Now, here is some research that is really cool, okay? HIV treated with electric currents into the blood has a significantly reduced infectivity for susceptible cells in vitro. Repeated cycles of treatment eventually achieve remission or cure. Now, I have some protocols in this webinar where you can produce this type of result. Next, via the use of electricity, herpes and adenovirus were inactivated completely in 10 minutes. Now, a study on the most severe dental pain showed local and distal electroacupuncture suppresses production of major pro-inflammatory cytokines and speeds up the healing process. Now, electricity is mandatory for life. It's an integral part of the human biophysiology. I don't know how deep you guys want to go, but this goes very deep into the mitochondrial electron transport system. Now, electroacupuncture can be the most effective form of treatment, even for weak and frail elderly patients. This is what I was telling you before. I use it on every single one of my patients. Now, from this new paradigm, we can use these patterns I'm about to show you to diagnose diseases in ways that were hidden before. Now, the pattern, many acupuncturists and healthcare professionals aren't even able to diagnose this one root cause of disease. It's not on their radar, and this causes them to jump into treatment blindly treating, hoping to get lucky. Fortunately, you can easily nail the diagnosis when you adopt P3 method patterns. Now, here's how the primary pattern diagnosis happens. It happens using two filters. Number one filter is the 7 major root causes that I go over in my classes, and this webinar is focused on number 7, dental. Now, but the whole point of using the 7 major root causes or any method of diagnosis is to get down to the one primary acupuncture channel that is failing to hold a charge because maybe it has something wrong with one of these 7. Maybe there's a scar cutting across the stomach channel, which is failing to feed enough chi into the stomach organ, and then the stomach organ can't function properly. That sort of thing. So we want to narrow our pattern diagnosis down to one primary channel. So a problem in any of the root causes, those 7 that I just listed, is possibly related to dental. Of course it is. That's because the acupuncture channels flow through the teeth. So every channel is represented on a tooth. So once you're diagnosing from these new patterns, you can create protocols that achieve maximal results. Now, protocols, you guys already know how to do this. Plan for today's treatment, plan for future treatments, give recommendations, make proper referrals. I'm going to be teaching you some real protocols coming up. But we need EAM variables. These are things that I teach in my classes. And needle placement, I'm going to be giving you some specific protocols on tonight's webinar. Now, frequency and power, I have 2 slides coming up to go over briefly, but we don't really have time to go over all the variables. But I have selected the ones that are most sticking point for practitioners. So frequency. So here's a frequency chart, and you guys can get the slides and have this. Jeff can give you the slides. And you know, when you look at this, there's a couple ways of choosing a frequency when you're giving a treatment. I will tell you that I use multiple frequencies at the same time on multiple patients at the same time. And 80% or more of my patients definitely get a slow frequency, such as 1 to 2 hertz every treatment. And that's because beta endorphin and ACTH is so healthy. And we have patients that are in pain, I'm sure you know. Why not give them an all-natural, healthy painkiller, beta endorphin? And so that's a little helper for you for the frequency variable. Now, this is what I find practitioners big sticking points. They forget to spend time and dial in the correct power level. Now, for intensive purposes, what I'm talking about when I say power level is how light or strong does the patient feel the stim? So you do your needling, you hook up your machine, and then you have to turn the machine on and ask the patient, tell me when you feel it. And then you slowly turn it up. And they say, okay, yes, I feel it. Then you're not done yet. You have to keep asking the patient, okay, is that feel light, moderate, or heavy? And depending upon what they tell you, you're going to want to change it. If they say it's moderate, but you want it light, you're going to have to decrease it and then say, okay, how about now? Is that light? How about now? Is that light? And you keep turning it down. You have to take your time with the power level, because look at this chart and it's counterintuitive. So let's see if you can see my cursor here. I think, okay, you can see. So I'm talking about if a patient comes in a lot of pain, right? You want to use a light amount of power. Isn't that counterintuitive? A patient comes in a lot of pain and you want to use a light amount of power to get the maximal result. Anywhere that you see smiley faces, the pain decreases, and everywhere you see sad faces, the pain increases, and you're aiming for the sweet spot, which is 3 smiley faces. So let's do another one. A patient comes in only a little bit of pain. You want to use a moderate or even heavy amount of stim. That sounds crazy, right? Well, that's because if you use just a little bit of stim on a little bit of pain, they may not feel any results and they may think acupuncture may not work for them. But if they come in just a little pain, use a moderate or a heavy amount of stim. Follow this chart. You can get it. That will help you with the power variable of those variables that I just showed you on that previous slide. So finally, it's now time to learn my favorite part, the dental acupuncture and oriental medical healing system. DAO Healing System 101. It's a complete system of diagnostic and EAM treatment protocols, which will enable you to nail the diagnosis of any disease using the channel-based system of the P3 method, which I just briefly went over, and the #1 root cause, dental. It will elicit the release of neurotransmitters to eliminate pain and/or inflammation. It will reduce viral, bacterial, and fungal loads and directly treat infections which wreak havoc on the immune system. I just showed you some research, and I'm about to show you a protocol to do this. Address the neurotoxins and allergens being released by the pathogens hiding inside of infected teeth. This is so deep, there's no way I could possibly teach you everything in 1 hour, but I've selected what I think are some of the powerful ones to teach here. So the dental acupuncture channel connection. Each acupuncture channel provides qi for a specific tooth. An infection in a tooth drains qi from the acupuncture channel, and a deficient channel cannot provide enough qi to the tooth for optimal health. It makes sense, right? If the stomach drains the stomach channel, so it's no longer providing enough qi to the stomach tooth, that tooth starts to decay or die. Now, if it could go both ways, there could be an infection in a tooth that drains qi from the stomach channel, then leading to every tissue that the stomach channel is on having a problem. So many times an infected tooth shows no signs of disease in the mouth, but these signs, symptoms show up on the channels in the rest of the body. So seeing this new paradigm that every tooth is connected to an acupuncture channel allows you to look for and uncover the cause of disease in an area that goes unchecked by every other practitioner. Now, I've selected the top 3 dental issues: 1, root canal; 2, wisdom tooth cavitations; and 3, toxins such as mercury. And like I said, we don't have time to go over everything here, but we will go over the first 2, root canals and wisdom tooth cavitations. So every tooth is connected to a channel. That's what I was telling you. And for this presentation, let's go with a very common problem, which is the wisdom teeth. So 4 channels, most of the teeth, 2 channels flow through, But in terms of the wisdom teeth, the 4 fire channels flow through the wisdom tooth. If you look over here, tooth number 1, tooth number 16, all the fire channels flow through there. And if you studied with me, you know that we relate triple energizer to the sympathetic nervous system and pericardium to the parasympathetic nervous system. Which means that a problem in the wisdom tooth, which is affecting those fire channels, can possibly also mess up the autonomic nervous system. And I have a case study on this coming up. But now you're capable of diagnosing the root cause of disease that has been misdiagnosed by practitioners everywhere. It's not misdiagnosed by acupuncturists only. It's misdiagnosed by medical doctors. It's misdiagnosed by dentists. Dentists don't look outside the mouth for disease, and medical doctors rarely look inside the mouth for disease. This is a huge vacuum that I'm showing you guys on this webinar that we can just take over from here. Now, let's dive into protocols and case study. First, let's talk wisdom teeth. So we can balance the autonomic nervous system and simultaneously charge up the deficient channels. Here is the first protocol I want to give you guys tonight. We can do that by inserting chi into the affected channel. And I told you it's the fire channels, but now we're even narrowing it down to triple energizer and PC6, triple energizer and pericardium channel, because we're kind of narrowing it down for this example to the autonomic nervous system. Simply by inserting this benevolent chi into the deficient channel, that's going to restore the charge to these fire channels, and the tissues along those charges are going to start, being able to function properly again and replicate. The cells along that channel are going to be able to replicate. But here's like a double whammy. 1, you're inserting benevolent chi into these fire channels, but 2, this is a protocol which will balance the autonomic nervous system. Here's another protocol for you. The autonomic nervous system is related, and one of the things on those 7 root causes is the adrenals. And so we can give somebody an adrenal rest, and that's what this treatment is here. T12L1 Huato Jajis, 80 hertz, low to moderate power, 20 or more minutes, and patients feel like they just they're on a beach for the treatment time, and they feel like they're on a beach for a couple of weeks after. When I had it done to myself, it felt like 2 weeks I was on a beach. And this is a way to give the adrenals a break. Now, here's 2 protocols, right? But let's do a case study using these protocols, all right? So a 42-year-old male, you don't have to write everything down. You can get these slides. I've highlighted what is important about this. Current complaint, irritability, insomnia, heartburn, weight gain, low back pain, anxiety, and fatigue. Of course, this isn't the real patient's photo. I changed the photos to protect them. Now, previous surgical history, I underline in red, had 2 wisdom teeth extractions, number 16 and 17, and those are the fire channels. Now, hopefully I did a good job of showing you proof that more than 280 million Americans have had their wisdom teeth extracted, and 3 out of 4 wisdom teeth extractions turn to silent infections called cavitations. So this is very common. And before I knew this, I mean, the day that I learned this, it was just like a baseball bat smacked me in the side of the head, like, wake up, hello. I did a grand rounds a couple of years ago. I didn't plan the patients, but 8 out of 9 of the patients that I was filming a live grand rounds had dental as their primary root cause. So back to this case study, 2 wisdom teeth extracted, 16 and 17. They turned into silent infections called cavitations. Silent because it's not in the mouth. It triggered the autonomic nervous system to go into overdrive, and it stayed stuck in overdrive. And this is very common. A lot of people get their wisdom teeth extracted in their 20s or 30s, and they have problems down the road from this, and nobody can ever trace it back. So let's go through the 3 Ps for this patient. The paradigm for this patient was that a cavitation in the wisdom tooth drained chi from the fire channels and set the autonomic nervous system into overdrive, draining the adrenal glands, leading to sympathetic dominance with underlying deficiency. The pattern is a fire channel deficiency, and I tagged on the end with an autonomic nervous system imbalance. The protocol is the same that I just taught you, And here's what happened on the first treatment. The patient reported feeling calm and clear, more energy, zero irritability within 5 minutes of starting the treatment. Patient left the office with zero back pain and says that he feels happier and more optimistic than he has felt in a long time. Of course he has. He might have had this wisdom tooth silent infection cavitation for like 10 years. I referred him to a dentist to get a cone beam scan performed to check for cavitations in the wisdom tooth area. When this dentist found it, the dentist found a cavitation in tooth number 1 and 16. No surprise, I'm telling you how common this is. Patients had procedure, immediately felt better after infection was cleaned up. This patient kept coming back to me, and this particular dentist was so happy, he probably referred 2 or 3 more patients that same week. So I have a question for you. Come in the comment section, let me know. If 278,970,000 people in the US have gotten their wisdom teeth extracted, and 3 out of 4 wisdom teeth extractions leave cavitations, can just this one protocol be a game changer for some of your patients? Are you guys starting to see this? Come into the comment section. Let me know. We're not done. We have a couple more case studies and more protocols, but come in the comment section. Can you see the power of this? I mean, I'm so excited every time I read this slide. I didn't make any of this up. I just dug it up. I dug up the facts and made a webinar for you guys. Paul says, perform dental channel treatment. The patients are loving it. Ted says, the doctors couldn't get it right. I suggested a scan as you advised. Tooth extracted. 3 days later, dramatic improvement in many areas. John says, did a scan and sure enough, found a massive infection. All her symptoms are related to that tooth. And Dawn says, I use it on every patient, and every day I have people who cannot believe how good they feel. Let's talk root canals. So here's a protocol for a bladder channel tooth root canal, which are number 7, 8, 9, 10, if you look on this chart, and 26, 25, 24. These front ones, urinary bladder and kidney, flow through there. Now, here's the protocol that we went over the research that was able to reverse HIV and reverse adenovirus and whatever else virus. That is this protocol right here. So if you get nothing else out of this webinar, I hope that you take this protocol and use it in your clinic. Now, I put the points, but it's not really those points. What you do, you feel for the pulsing of the radial and ulnar arteries, or the radial artery only. That's okay. I'm going to show you a couple ways to do this. And you put your needle near the pulsing, not inside the vessel. Just get your needle close to the vessel, because blood, actually the outer covering of vessels is very electrically conductive, but blood is very electrically conductive too. So by putting your needle close to the pulsing arteries, you're able to get this benevolent chi directly into the blood, and more than a handful of studies show that it reduces pathogenic loads in the blood. It stops the fungus and viruses and bacteria from replicating, and they die off. So now I'm giving you this protocol to go out there and clean your patient's blood and help their immune system. Here's the second protocol for this. It's simply inserting chi into the deficient channels. That's why I wrote kidney, because we're working on a water root canal tooth here. Spleen is a cheater's point, because you got spleen, liver, and kidney. And then bladder 2, 4 hertz, 20 minutes, low power. Now, here's an example of just inserting this benevolent chi into the blood. This is dark field microscopy. On the left-hand side are 3 different patients. On the right-hand side are those same patients after, I believe, 40 minutes of inserting this benevolent chi directly into the blood. One, you can see the clumpiness on the left-hand side, and when this benevolent negative charge chi, which is the same in our batteries, gets inserted directly into the blood, this negative charge sits on the outside of the red blood cells. This is called zeta potential in the cardiology world, and it's way healthier. Of course, it's way healthier. Look how healthy the right side non-clumped blood is. Those are happy blood cells. Immune system can float around. Neurotransmitters can float around. They're not getting hung up on this. You know, the left side looks stressful. Looks like a person in trouble. So here's the actual treatment. I drew it out. You put your needle close to the pulsing artery. And here's what it actually looks like. Now, there's a couple ways of doing this. I prefer to connect the left side to the right side, as you see in this picture. And this is kind of overkill. If I would only do 2 needles with the wires, probably on the radial artery. You don't need 4 because the chi is going to get directly into the blood, and all the blood in the entire body goes past the radial artery every so often. I forget, maybe it's every couple minutes or so. So let's do another case study with the same protocol that I just taught you. So a 66-year-old female comes in, depression, dry burning mouth, eyes, throat, extreme fatigue, joint pain, insomnia, and headaches. Now, let's see here. Depression, dryness, extreme fatigue started 10 years ago after she was diagnosed with Sjogren's disease. Now, I'm sure you guys get patients, they come in with these crazy Western medicine diagnoses, Sjogren's, autoimmune, multiple sclerosis, whatever it may be. We can treat it by going back to the 3 Ps and using the acupuncture channel system. So whatever Western medical disease is, before you, I want you to diagnose it from your primary pattern channel diagnosis anyway. For example, Sjogren's is a problem of the mucous membranes. It's the immune system attacking the patient's own mucous membranes, and then it gets dry and really uncomfortable and damages. And so mucous membranes, I know, is on the urinary bladder channel. So with this patient, the primary channel is these water channels. And if you look at previous surgical history, you'll see a root canal tooth in number 8, kidney and urinary bladder. I didn't cherry pick these patients. I can take a random sample of my cases in my office, and 9 out of 10 of them are going to have a tooth issue related to their primary acupuncture channel. That's what I'm trying to tell you guys. So this patient had a root canal in tooth number 8 on the water channel, and she's having water symptoms, AKA she's calling it Sjogren's, and her blood pressure is 105/75, which is low. And let's go through the 3 Ps for this patient. The paradigm is that a root canal tooth drains chi from the water channels, leading to deficient tissues of the water channels, mucous membranes. Pathogens from the root canal tooth enter the blood and put out toxins which wreak havoc on the immune system, causing Sjogren's. The pattern is a water channel deficiency, and I tagged on there, caused by root canal tooth. Here's the protocol, the same protocol that I just taught you. And here's what happened to the patient. She feels happy, more energetic after removing needles. She called my office the next day to report that her dry eyes and mouth were no longer burning, and she feels like she has more saliva. She slept better that night than she can ever remember. She feels joyful, optimistic, and she's excited for her next treatment. I referred her to the dentist to get a cone beam scan performed with focus on the root canal tooth, and her treatment plan consisted of 3 times per week for 1 month and then to be reevaluated. The dentist found a massive infection in tooth number 8, but there's no surprise there because I'm telling you that every single root canal is infected after 30 days. Now, this dentist couldn't believe it. It's a different dentist than the previous case study. And this dentist and I have a working relationship where maybe I referred to him $300K worth of work last year, and he referred to me only $100K worth of acupuncture, but not quite balanced, but still good enough for me. Anyway, this patient came in the second treatment practically crying and giving me a hug that she feels that her Sjogren's is gone or gone into remission. This patient, I have to say, about 3 months after this first treatment, she has no sign of Sjogren's. She got her root canal taken out, cleaned up, and then she saw me for about another 2 months. And then now this patient doesn't need me anymore. And that's because this root canal tooth was draining chi, was a nonstop drain of chi on these water channels. The bladder and kidney channels did not have enough qi because it was drained by the root canal to keep up with healthy tissues that these channels power. So Tim says other diagnostic techniques take valuable time away from treatment. His method simplifies the process and leads you to assessing the root cause faster. Wendy says, I was blown away. You have tied together so many key foundational aspects. And Jill says, thank you, EAM. You are connecting the dots. And Mary says, I can't say enough about this course. It's worth every penny. My practice will never be the same. Let's do another protocol, you guys. So here's a earth channel, stomach, spleen, root canal, tooth protocol. Reduce the pathogenic load. It's the same protocol I just taught you in terms of cleaning up the blood, because these root canal teeth are dumping pathogens directly into the blood. And then charge up the deficient channel. Reduce inflammation. So I put spleen 6 here. It's a cheater's point. I keep saying that, right? Spleen, liver, kidney. So we get 3 channels. The qi goes to where the diseased tissue is. It goes to which channels need it. Why not give it the potential to do so by sticking 1 needle in between 3 wires and inserting qi there? And my treatment that I love for anti-inflammation is STE 36, 10 hertz, 20 minutes at low power. Let's do a case study with those same protocols I just went over. So 38-year-old male, he's an athlete, right knee pain, swollen, reduced function. On the right here is a picture of his knee before, on the day that he went to the dentist. So his right knee became swollen, red, and painful almost overnight. It started around 6 months ago. He went to the emergency room. They prescribed a course of antibiotics. The knee got better for a couple of weeks, then worse again. Why do you think that is? I told you there's so many pathogens that get dumped into the body that when the emergency room gave them antibiotics, yeah, they probably thought the knee was infected, but they didn't realize that there was an infection being dumped directly into the blood from his root canal tooth. And that's why possibly he got better. He got better overall because the antibiotic killed off some of the bacterial load in the blood. And then after that, it got worse again, of course, because that tooth is draining qi and dumping pathogens nonstop. So, and that's what I underlined. Previous surgical history, root canal, tooth number 3 on the earth channel. And let's go over the 3 Ps for this patient. The paradigm for him was that a root canal tooth drained qi from the earth channels, which wouldn't provide enough energy to the knee to heal completely. He liked to play tennis, so a lot of lateral movements. Deficient earth channel also led to indigestion. Now, the pattern was that earth channel deficiency. Primary pattern diagnosis, very powerful if you can get to it and stick with it. And the protocol is the same as I just taught you. And here's what happened. The patient leaves the office with no knee pain, calls the next day to say that the inflammation is reduced, and asked if it's okay to play tennis. The dentist referred him for acupuncture for a follow-up treatment. Treatment plan consisted of 2 times per week treatment for 1 month and then to be reevaluated. And the dentist found a massive infection in tooth number 3. But that's not a surprise to you guys anymore, because I told you every single root canal. Now, there's only so much I could teach you in this webinar, but there's probably 20 helpful things and protocols that we can do for our patients to help them with their dental. Now, this particular patient had the root canal tested. The picture on the left is the actual root canal when it was removed. The picture on the right is a list of some of the DNA PCR testing. I believe it was a PCR test where they tested for all these different bacteria. And it may be too small for you guys to see, but I will tell you that at the bottom it says a number 9 or greater indicates a serious risk. And I would say that most of these on here are greater than a 9. This is ridiculous. This person who is not like rare, they have a root canal dumping all this bacteria and viruses into the blood, and these viruses are a serious risk. And these people are out there, it's so prevalent, and they're out there living with this burden on their immune system and their acupuncture channel system. So question for you guys, if you're still with me, If 41,000 people per day are getting root canals and 100% of them turn into cavitations, no one in the medical community, including dentists, address it. Are there countless people out there you can help with protocols like these? Come in the comment section while I take a sip of water. Do you guys see the power in this? All right. Okay. I got it. Kelly says yes. Stacy says yes. Yes. Thank you from Julie. All right. So Nicole says, I've been practicing for 21 years using his classes. I get better results with my most stubborn cases. Andrew says, went from one patient an hour to now seeing multiple patients per hour, hiring another acupuncturist to help with the patient load, and routinely having a 1 to 3 month wait list. I see this a lot, and it's because the sheer number of patients that we need to help. Ernest says, her urologist was pleased and told the patient that acupuncture is great and to keep it going. It fixed what we cannot. And Margaret says, Dr. Jeremy's courses have revolutionized my practice. Been practicing for almost 20 years. So I'm just curious, we're not done yet, but do you see now why my Tao healing system eliminates any chronic and stubborn disease in your patients and turns you into a modern day master, helping patients that no one else can? Do you give me a yes? Let me know if you can see it. And have you gotten value so far? All right. Susan says, absolutely. Heather says, I see it. Alicia says, yes. So now I'm going to get to your questions in just a few minutes. We're going to do a full Q&A. But first, I have some questions for you. How would it feel to be the only medical practitioner to successfully diagnose the real cause of your patient's disease? What would it feel like to consistently and successfully heal your patients when no other doctor or medical modality could? Imagine the joy on your patient's face when they experience real lasting relief for the first time in years, all thanks to you. Now imagine the disbelief of medical professionals who'd failed to even diagnose the problem you were able to solve so easily. Imagine the referrals you get from both patients and peers. No more frustration when traditional approaches you learned in school fail to get results. No more wasted hours searching for answers to your toughest patients' problems. No more questioning whether acupuncture can help certain patients. No more losing patients because they don't get lasting relief. Just a clear, one-of-a-kind healing system that looks nowhere else, or that looks where no one else looks, uncovers hidden disease that no one else sees, and provides lasting results that no one else can provide every single time someone walks through your door. What would life look like a year from now? Just think about it. Now, I'm not sure why you're here today. Obviously, I can only show you so much in a single webinar. I mean, and I promised value-driven, and I crammed research and protocols in here for you guys to start using. So I want to take a quick moment and introduce my upcoming class, which is Electric Medicine 3 live stream happening May 1st and 2nd. There's, like I said, there's only so much I can teach you in one webinar. I'm doing a whole event upcoming about dental and, you know, teaching the full gamut of what to do with dental and how to convert that in your practice and just create those breakthrough permanent reversals of patients' disease using the acupuncture channel system. So Jeremy says, my favorite course in 20 years. Jonathan says, it's the future of medicine. And now let's do a question and answer after I take a couple sips of my water here. And I left the link up on here also. And here's my email address. If you guys have questions, just email me. And Jeff, I'm ready for questions after I take a sip of water.
Alrighty, I am back. And thank you so much for that amazing webinar. So I just put a link to Dr. Jeremy's upcoming class in the chat. Also link to his email address if anybody wants to contact him with any questions. I'm going to go right into the questions tab right now. And just so everybody knows, I'm not going to look in the chat. So if you do want me to see what you're saying, it's going to have to be in the questions tab. Dr. Jeremy, are you ready?
Yes.
All right. First question. Are the root canal infections still occurring with good dental work? And if it's not seen by the dentist and other imaging techniques, how do we know it is infected, especially if people are not experiencing problems?
Great question. But I believe it's 2 questions. So what was the first part of that?
So are the root canal infections still occurring with good dental work?
Okay, so a good dentist, which is about 2% of the United States, maybe more, will not recommend a root canal procedure to be done. And then what's the second part?
And then the second part is, if it's not seen by the dentist and other imaging techniques, how do we know it's infected?
That is also great. So there's a couple ways. One is I teach diagnostic techniques, staying within our paradigm. So I teach how to diagnose it from our point of view, from a channel point of view. And also when an X-ray, you're right, an X-ray will not show the silent infection, but a cone beam scan will. And so another thing I go over in my class is I give you my templates for getting how to get the perfect cone beam scan. I give you my templates on how to find the perfect dentist. Once you find the perfect dentist, you'll know it right away because you're going to get 2 or 3 referrals that same week that you sent a patient there.
All righty, next question. So what can we do if we have mercury in our teeth fillings?
That's a great question. I didn't have time to go over mercury, but I will say you can get the mercury removed, and I highly recommend you do so. And what we know, it's 2021, right, Jeff? We know mercury is not the greatest for us. In fact, I'll go so far to say that top toxicologists see it as horrible for us. It jams up the electron transport system. It's so toxic, mercury, and every time somebody chews, some vapor gets exposed. Now, here's the crazy thing. When it's inside the mouth in the tooth, mercury is considered fine. It's a dental material. But when mercury is removed by a professional, then they consider it a toxin, a full-blown toxin. So you actually have to get your mercury pulled by a special dentist that wears hazmat suits and takes proper precautions. Nonetheless, I really do believe it's a good move to get your mercury taken out of your mouth. Now, there's another question after this, which I go over in detail in my upcoming class. But I will say that you can get a bioidentical blood test that will tell you what dental materials the dentist should use on you that will not react and not cause problems down the road. We do have a handful of protocols to deal with the allergies put out by the pathogen, with the toxins put out by the pathogen, and with the overreaction of our immune system that can happen from the dental issue. I hope I answered that question. I got off on a little rant there.
It happens. I think you did. Let's see. Next question. So a tooth that had a root canal, if it is not done, or sorry, if it's not well done, of course will keep leaking infection. But if the tooth, if it is the tooth, it has been well medicated and sealed, will there not be an infection locally or in the body?
That's a good question. And every single root canal is infected after 30 days. And that's provable by pulling a root canal.
Alrighty, and then have you found a relationship between resistance in the tissue like muscle and the need to use more intensity of electrostim? And if so, how does this relate to your model?
That's a good question, complicated answer, but I will say that we can use this qi in many different ways. For example, when we're putting qi into the blood, we just want to barely feel it. It doesn't need to be strong. You just want to make sure that the qi is getting in there. Different than when you're using, like, if you want to work on the muscle quality itself, then you want to use a different type of power, which I teach, so you want to use different power. I will say that when you get, if you're sticking with the P3 model and you come down to a primary channel pattern diagnosis, that can be considered a root treatment, and you only need to insert qi into there, and the power doesn't need to be strong at all. But when you're treating something like pain and you're using a global analgesic like large intestine 4, then you want to follow that power chart. When you're treating pain and inflammation, you want to follow that power chart with the smiley faces. Whereas when you're simply inserting chi into the blood or into a channel, then you can use like low power.
Alrighty.
Of course, we go over in extreme detail in my classes. That's the variables I was trying to show you guys before.
Perfect. Let's see. Next question, because we have a bunch. How did you get the relationship between the channels and teeth map?
That's a good question. And so I got it from my mentors and then tested it in my own clinic for several years.
Perfect.
But there is a couple standardized channel connection charts that are out there. The one that I use, I verified with something like a Mead machine. In other words, a patient comes in, if I run my Mead machine, it measures voltages or channel charges. And if I find that a channel is horrible, drained, and reversed, there's a good chance that a tooth on that same channel is the problem.
Alrighty. So I think this question goes back to the very first case study that you showed. And then the question was, is the second protocol done bilaterally?
Can you read that question one more time?
Well, so the question itself is the second protocol done bilaterally? But I believe that this goes back to the very first case study that you shared. So okay. I remember when she put the question in.
Should I just go back to that first case study? Because I forget which one.
Yeah, let's quickly go back to that.
Give me a second, you guys, and I'll get back there.
Thank you so much.
No problem. Where is that? Case study 1.
So it would have been the second protocol.
Okay. Okay, so the T12 L1 Watto-Jajis, you would do it. Hold on, I lost something here. Okay, I'm back. So you would do it bilaterally, yes. And if you want to get into detail, then the left adrenal is higher than the right adrenal because of the liver. And so you would really want to do T12 on the left and L1 on the right. Watto-Jaji, 80 hertz, 20 minutes.
All right. Next question. Are you using any other points in the treatment besides the 2 points listed in the protocol?
So by the way, that previous protocol we just went over, I never like to treat a patient face down because it stimulates a sympathetic dominance. So there's another little trick for you guys. I always treat all my patients in lateral recumbent when I want to use back points. The results are better.
All right.
So what was the recent question?
The question was, are you using any other points in the treatment besides the 2 points listed in the protocol?
What I do now is 4 points, and I'm happy with 4 points total. I use 2 points for the root treatment and 2 points for the branch treatment, and everything gets electricity.
All right, next question. My wisdom tooth is inclined and is at an angle. Can I fix it?
You're most likely going to need help with that one. You can do a lot. And I'm going to be teaching you a bunch of protocols. And you can get yourself better. And if you keep treating yourself, then yes, the answer is yes. But if you don't want to be treating yourself every day or once a week, then you might as well go ahead and get that removed properly. The dentist needs to extract something properly so that it heals and doesn't turn into a cavitation.
Alrighty. Next question. What about implanted teeth? Is there a relationship between implants and the invisible pathogens?
So the relationship is, well, invisible infection, right? The pathogens we can see under microscope, but invisible infection meaning that there's no symptoms in the mouth. The problem comes out elsewhere. Can you repeat that question again?
So is there a relationship between teeth implants and invisible disease?
Okay, so teeth implants is a much better option than a root canal because a root canal is a dead tissue and it rots and it harbors bacteria. But an implant is generally good, and if you use the right material that resonates with your body, therefore get the bioidentical blood test to know which material, then an implant is generally good. The relationship is that if somebody has an implant already, then you know they have a history of that channel being a problem.
The next question is actually a really fun one. With webinars, it feels a little overwhelming. What would be the one protocol that you would start with in clinic tomorrow?
I would use the blood electrification protocol. I told you 280 million Americans have their wisdom teeth taken out, and 3 out of 4 wisdom teeth extractions turn to cavitations, which dump pathogens into the blood. That's number one. I also said that 100 million Americans have root canals, which constantly dump pathogens into the blood. So I would say that the majority of us have pathogens in our blood, because even if we didn't have any dental issues that's causing it, the pathogens tend to come from the outside world and just build up in the blood. So I would use that blood electrification treatment.
Alrighty, and the next 2 questions are the same. Do you have a recommendation for a specific eSTIM machine?
Yeah, that's a long answer, but to keep it short, those little ETOs, the ES130s, are a solid machine. They last forever, and you're going to want multiple of them so that you can do multiple frequencies on the same treatment, and also probably get multiple rooms going and let the electricity do all the work.
And then just to let anyone know, the ES130s are currently on back order, but they are expected to arrive this week. So we do have an alert option. So if you do visit our website and click on the ES130, you can get alerted as soon as we have them back in stock, so we can get them ordered for you. And again, it should be this week. All right, looks like we have a couple more questions. Are you okay with taking a few more?
Yep.
All righty. How do you specifically refer a patient to a dentist? For example, what lingo do you use to get the dentist to take the referral seriously? Some doctors, I feel, would scoff at an acupuncturist saying there was an infected tooth.
You are absolutely right. We are up against the majority here, but that's what makes it so cool, because nobody's doing this. And this is why I created a whole event coming up May 1st and May 2nd to teach about this, because I'm used to it. I'm used to dentists, other healthcare professionals laughing in my face. But during this event, I'm going to teach you how to easily find the proper dentist. And once you find it, the referrals flow back and forth. I give you my letter. What you do is you write a letter that the patient brings and hands to the dentist themselves. And in this letter is just a very little bit about you, but more guiding the dentist to whichever tooth you've diagnosed that you think is the problem. And then from that one referral, you get to see if that dentist is the right one. Do they refer patients to you? Do they refer that patient back to you? Or did they scoff at it and laugh at you? So I teach a lot of things. One is I teach you how to kind of interview the dentist, what to say to them. I also give you my template letter to help you deal with that. Because how incredible is this with the sheer millions of people that we can help that nobody else is helping? It's up to you guys to help them. And at the same time, we're against the world. And I believe I showed you in the beginning why that is. It's because dentists have to follow a standard of care rule book, which is causing all this massive, I don't know what word to say, but that's where we are.
All righty. We are getting some really great questions. So thank you to the audience for asking such really good questions tonight. Would the same type of protocols apply to individuals who've had dental issues, but not from dental work, rather poor dental hygiene?
Yes. So this webinar, I only was able to focus on root canals and wisdom tooth cavitations to show you how big this is. But we as acupuncturists don't even need a dentist for something simple like a cavity. In a cavity, the tooth is still alive. We just need to restore charge to the channel, and then that cavity can actually go away, because the tooth is a living thing that's pumping fluids through the tooth and pumping the immune system through the tooth. And so if we restore charge, we can handle simple dental issues. I hope I answered that question.
All right, next question. When you're speaking of lasting relief, after how many treatments with what frequency of treatments for typical chronic conditions are you seeing the lasting relief for?
Mm-hmm. Well, so I'm used to getting results on the first treatment, and then it depends upon how many channels are leaking and if the problem is still there or not. Because if the problem is not there anymore, for example, thinking one off the top of my head, let's say a patient has a scar on the stomach channel. No, let's keep it dental because we're in webinar. We're in dental land here. Okay, let's say somebody had a wisdom tooth extraction that led to a silent infection, which is draining chi from the fire channels. And then I see them one day fill up their fire channels, and then all week until I see them again, that wisdom tooth cavitation area is draining chi from the fire channel. So by the time I see them next time, they're back to where they started. Using the example of once per week. Now, let's say I treat them, I fill up their fire channel, and then the same day they get that cavitation taken care of, and then they come back to me a couple days later. So now there's no more drain or problem on the fire channel, and I simply fill that channel up for them, kind of jumpstart it, and then that patient their disease should not come back. If all the channels are fixed and supplying enough chi, then their problem should never come back. Hopefully I answered that one. That's complicated question.
Absolutely. I mean, I think all of these are complicated. Are you okay with doing a couple more?
Sure. And also, you guys, my email's here. If I don't get to answer it, feel free to email me.
Perfect. I'm going to throw that in the chat again, just in case. Perfect. Back in the chat. All right. Now let's get back to questions. Sorry. Have you noticed this kind of bacterial dump into the blood without having a root canal? And have you used the system to treat the blood, or I say lymph, in this way?
So the first part of your question, I want to answer yes. I have noticed the blood having pathogens before I knew about the dental connection. However, then I found out about the dental connection, and if what I'm saying is true, that 9 out of 10 patients have a dental issue, then how can I know for sure if this blood pathogen thing exists without the dental connection? Because 9 out of 10 patients have the dental connection problem. Did I answer that one?
I think so. Let's see. How about patients with pacemakers? Because you said you treat everybody.
Yeah, I do actually. I stay away from the pacemaker, and especially if it sends signals. You don't want to interfere with those signals, and also you want to use their cardiologist. I think I did a lots of webinar on EAM for cardiology.
You did?
But you want to use their cardiologist as a source of referrals. A lot of times that cardiologist would love to work with an acupuncturist, but also needs to prescribe a low-dose antibiotic for the patient with the stent or the pacemaker. And a lot of times that allows you to get a nice referral going back and forth with the cardiologist.
All right, let's do one more question. How about this one? What about polyneuropathy? Patient is 66 years old and obese. He can't feel his ankles or feet. He walks like he's drunk and can't stand without shuffling. His hands are numb. He has trouble writing. Both LI4s are extremely sunken. Would I look to the kidney channel or perhaps spleen due to diabetes?
Mm-hmm. Look to the channel where it's happening. So if you're telling me large intestine 4 is sunken, then I would look into the large intestine channel, and I'm almost positive you'd be able to find a root canal on the metal tooth. Because no matter how severe the disease is, no matter how crazy, no medical doctors know what's happening, it all goes back to the power in the acupuncturist's hands. If we're using the acupuncture channel system and we're believing this paradigm that I'm just showing you, which, believe me, it works. I've been using it for many years. Then every single disease, just about every single disease, is from a channel deficiency, and 9 out of 10 of the United States population has a dental issue leading to that.
All right. Well, thank you so much, Dr. Steiner. This was such an amazing webinar, and I know everybody that attended tonight really enjoyed it, and everyone who's going to watch it later on the recording will also enjoy. Please check the chat for the link to the upcoming seminar. It's happening on May 1st and 2nd, and there is a discount for attendees of this webinar, so please check that link. Also, if you have specific questions for Dr. Jeremy, his email is also in the chat. Dr. Jeremy, was there anything else you'd like to say to the audience?
I just want to say thank you, everybody, for showing up. I had a lot of fun, and I hope you guys got some value out of this, and I urge you to implement and use this stuff in your clinic tomorrow. I love to hear feedback from you guys, and I want to work with you. So if you are interested in this, I created a whole event coming up May 1st and May 2nd. The link is here. And also, here's my email address. If you have any question, send it to me. If you have any question about the class, send it to me also. And I look forward to meeting some of you and working with you all. And thank you, Lassa. Thank you, Jeffrey, for having me on here. So thanks to everybody for coming. I hope you guys had a good time.
I think everybody did. I want to thank everybody as well. We have another webinar tonight, which is going to be featuring the CSOMA leadership team, which is the California Oriental Medical Association. And we're going to be talking about advocacy work and how you guys could get involved. So if you haven't registered yet, there's still time to register. It's going to be happening at 10 p.m. Eastern time, which is 7 p.m. Pacific time. That is tonight. So we're doing a double feature. And then next week on Thursday, we'll be hosting Martha Lucas for Chinese medicine and dermatological conditions. Also, registration up on our blog. Dr. Steiner, again, we can't thank you enough, and I hope everybody has a wonderful evening.
Thank you.
Thank you.